wonder if it's not cold because the door was open for a while.
It's warm on that side.
Oh,
Like the
is it?
AC's not running.
Oh, that's unfortunate. It's so weird how it's just separate.
Very moody and temperamental.
Yes. Probably very old. Do we know their ETA? Melissa? Okay. Okay. Good morning. Aloha and welcome, and mahalo for the gift of your time in joining us today. Governor Josh Green will sign historic legislation today, including HB 2404 relating to income tax and SB 1035 relating to general excise tax. These bills will provide significant tax relief. Facilitated questions and answers will follow promptly after remarks conclude, and the formal bill signing will commence shortly thereafter. Without further ado, it is my privilege to introduce to you Governor Josh Green.
Aloha. So this is a historic day, and I'm so grateful to our legislative leaders for what you've done. You have lived up to our hopes after so many years, and so thank you for this. We're going to start right off with a couple comments about the two bills that I'll be signing today. So as you know, when we came into office, we committed ourselves to transformative leadership. And specifically, that means looking at how we can afford to live in Hawaii, how our working families can afford to live in Hawaii. We call it our GAP plan, or the Green Affordability Plan. The legislature passed phase one, or part one, in the first year, which was extremely helpful. But they sure gave us a tremendous whopper of a tax break now for working families. And this is the transformative moment we've been waiting for. I'll also be addressing a significant change after many years of how we tax healthcare services. Again, I'm very grateful to our legislative leadership, and we're going to dive into both of these. So this is the largest tax break that we've had in history for our working families. Let's go to the next slide. So as you know, GAP 2 builds on GAP 1. These were the changes that we had to have because we've seen an exodus of people who are living paycheck to paycheck. We've seen an exodus of those individuals going to the mainland, working families because they just can't afford rent. And we have the highest cost of living in our country. It is a great burden for people just starting their careers. So our cost of living has been hurting us. It's hurting our ohana, it hurts our friends, and it hurts community well-being. We've even seen tragic outcomes in people's lives when they feel they can't care for their families. They struggle to make ends meet in our state. People are working multiple jobs, and they live, like we've said, paycheck to paycheck. 44% of all of our state are ALICE families, which means asset limited. 63% of all Hawaiian families fall into that category. And with the recent inflationary pressures on people, it's been even more difficult. So this had to happen. We had to cut taxes for our people. You can see that was a graph right as I was getting started. I'd like to note that my bald spot was the same size then as it is today. So the job is not affecting me negatively. I'm very proud to say. Had we not passed this bill, though, all gone. And you can see that what we have to do is we have to expand the tax breaks for people that are working the hardest. Let's take a look at what this does. Okay, let's go to the next slide, please. So it's a partnership that we have with the legislature. This will provide historic breaks for individuals that are working, like I said, mostly under $112,000 for families. And I will break those numbers out as we go today. But we are going essentially from being one of the highest taxed states in the country to one of the lowest taxed states over the course of this period from starting early in 2025, January 1 through 2031. That should be the take-home message. And you'll see that in our, let's see, first this slide will show you the amount of tax breaks, which is quite extraordinary. This shows how the standard deduction rises very precipitously. And when you think about where the kind of the center of the curve is to help families, it really is heavily weighted towards people, like I said, from very modest income, under $30,000 a year, up to about $112,000. It is a $5.6 billion tax reduction between now and 2031, and it's a 70% decrease, 70% decrease in income tax for working families. 40% now of our taxpayers will pay zero state income tax, up from 25%. So this is about equity. Now, people are going to ask, how can we afford this? The fundamentals are this. Individuals who are working paycheck to paycheck will spend every single dollar on local businesses, on their rent, on cars, on their health care needs. They will spend it here for their families, for school books for their children. They will all spend it right here at home. Individuals who make many millions of dollars, God bless them, we're excited for them, but they already have enough resource to maintain their needs. Individuals who are in a more modest situation are trying to pay rent. So that's how this is going to stimulate our economy. And one thing that I'm appreciative of is that in this particular case, we have people with much more conservative tax ideology meeting individuals with more moderate or even sometimes left of center political ideology, all coming to agree that we can help our families with this tax burden cut. And let's take another look at the next slide. There you go. $5.6 billion, 70% decrease. And take a look at where the curve is. It's really, right now, very tough. You can see that we are the second highest taxed state in the country. We will become the fourth lowest state taxed peoples. And that means a lot of families will have more resource to live here. Let's take a look at the next slide. Now, this is where the tax burden falls the greatest. It really transforms what we're doing for people. And the focus has been on working families more than anyone else. You'll see that, of course, higher income taxpayers always pay a larger share of the income tax. People make a lot more money. And in my experience, in talking with families that are doing better, they're happy to see their next door neighbors be helped. That is very important. We are an ohana, after all. So I want to thank people for their work on this. I'm going to also go into another couple of comments. Let me see if I got one or two more slides. Yes. Okay, so as you can see, we're helping local families, and our legislators are going to dive into some of the additional details. There's been another great challenge we've had in our state, which is finding enough healthcare providers for our local families, particularly those who are on Medicare or Medicaid. Why is that? Having been a physician for, 25 years in our state, essentially, we can't generate enough resource often to care for all of those individuals who are on Medicaid. Back in the day, we had 252,000 individuals on Medicaid. That was 1 out of 6 of our population. And then because economic difficulties have ensued, which we're helping to solve with the big tax break, we've gone from 252,000 people on Medicaid to 465,000 people. That went from 1 in 6 people on Medicaid to 1 in 3. And the Medicaid reimbursements, as healthcare providers will share with you, are quite low, often below even the cost of just providing the care. So what have we decided to do? A couple things. We've been increasing the Medicaid reimbursements to care for our people. It's always good to provide preventive care, avoiding end-stage disease. We have to be careful. We have to diagnose renal disease. We have to diagnose diabetes earlier. We have to diagnose cancers earlier. We can only do it if we have the healthcare providers. So we've done several things. We're repaying their loans, which you heard about in the last few months. So healthcare providers will have their loans forgiven if they care for those who are on Medicaid. We increase reimbursements for Medicaid, all upstream positive investments to save money. And now we're getting rid of the general excise tax, which is 4.166% on the neighbor islands, and it's higher here on Oahu, 4.666%. Very difficult because, again, our providers will leave the discipline, and then we'll be left to paying for expensive people in the emergency department. And I have lived that life, okay, where costs are astronomical. So today we're very, very appreciative of the healthcare professionals that fought for this for so long. So thank you guys. Thank you for sticking with this fight. So you can see what the impact is going to be. We're going to exempt medical care under Medicare, Medicaid, and TRICARE, that's military care, from the GET. It removes that burden so that on the neighbor islands and in the rural, the urban settings where there are a lot of people on Medicaid, we won't have to pay that tax. That's going to bring more providers to our people. It's super important. And I think that you will see that Hawaii has always been the health state. We have the healthiest outcomes. But now we're going to actually see a big surge in the number of providers we have with that trifecta of action. So big tax breaks so people can afford their copays, afford their health care, afford their rent, and some stimulus by getting rid of this tax, which has been pretty burdensome on the services we care about delivering most. One more slide, I think. Okay, that's just a mahalo slide to all of you and all the state for understanding that these are fundamental changes. And now, before we even get to the large question of can we afford this, I want you to understand what the real philosophy is here. The philosophy is the more we support people, the more resources they have, the less they will be reliant on programs like Medicaid and social programs, which can be very expensive. I shared with you we went from 1 in 6 people to 1 in 3 people on Medicaid. As we support them, as we support people's quality of life and their ability to pay and to survive on their own, a lot of those other programs will see cost savings. So we're being smart about this. We will work with the legislature going forward to make sure the budget is right fit. Of course, we do that every single year, but this has been a long time coming for our people. We put affordability first, and we put our people first. Aloha.
Mahalo, Governor Green. Next, please welcome Senator Sharon Moriwaki, Vice Chair of the Senate Committee on Labor and Technology and Senate Committee on Ways and Means.
Aloha, Is that on? See this? Aloha, everyone. I'm pleased and honored to represent the Senate at this historic meeting. And Chair Dela Cruz wanted to come, but he could not change his prior commitment. So I'm glad I'm here in this historic moment. You know, this bill is historic. It's the biggest tax cut, as Governor said, in the history of the state. Mahalo, Governor, for signing this bill. This bill is a systemic fix to inflation and to the rising cost of living. It will especially help, as Governor said, the ALICE population, the asset-limited, income-constrained, but it also will help the moderate-income families. And what we have done is increase the standard deduction amounts and substantially increasing the amount of the lowest tax bracket while basically eliminating the current bottom bracket. So over the past years, we have tried to address the asset limited income constrained families by various fixes: the income tax, earned income tax credit, the child and dependent tax credit, the food and excise tax credit, and of course, increasing the minimum wage. But without this fix of the tax system, which hasn't been adjusted for inflation since 1978, think about that, 40 years, we would erode whatever gains made to help the ALICE and moderate income families. Our choice to help ALICE and state and moderate income families will cost over $1.3 billion in reduced state tax revenues. But implementing the tax cut, as Governor said, was a choice, and the choice was to help our local families. And it was implemented with a prudent fiscal view of having 6 years to address that cost and how we do it. It's also having more productive families and workers, but it's also looking at tightening our budget and looking at how we might look at the 40,000 vacancies and maybe restructuring government to make it much more efficient, much more cost effective. Looking at data and looking at the technologies that we have to assess and plan forward. So, Governor, you're signing HB 2404 into law is also a testament to working together for a common goal. It's a historic achievement. Many worked on parts of the problem in the past, but not until this session and this governor signing this bill did we have a bold, systemic problem solution for our state and for our many, many residents who are having a difficult time. So I would like to mahalo the House Finance Chair and also Yamashita and his team, and also to Chair Dela Cruz and our Senate colleagues as well. So mahalo, Governor, to your administration as well. Aloha. Aloha.
Mahalo, Senator Moriwaki. Up next, I would like to introduce Representative Kyle Yamashita, Chair of the Finance Committee.
Aloha, everyone. So this is a monumental, historic day that we're signing these two bills into law. And thank you, Governor, for signing them. We really appreciate it. This will be something that will benefit the working families. As what I'm going to say is kind of repeating what everybody said. So, but I think it's important to say that this is helping working families to provide much-needed relief. By 2030, this is the biggest tax cut in state history. We'll be doubling the standard deduction in the first year for minimum wage employees. That will be will give them great resources that they need immediately. The adjustments that we're making to the brackets is important because if we don't make these adjustments, as we know, minimum wage is going to be going up, and we have to make these adjustments. Otherwise, we'll be overtaxing them. So those are kind of important things. By 2030, like others have said, this is going to be by 2031, it's going to be a 71% decrease in taxes for everyone. The average family making $88,000 will see by 2031 a $20,000 savings for them. So this will go into their pocket directly, and will be helping all of them. In general, I think we want to thank again everybody for working on it. Thank the Senate for their help, the governor and his administration, tax department, and all. I'd like to thank my colleagues for supporting this going forward. I think questions will come up later, and I think we'll be answering some of those. As far as the break for the Medicaid, TRICARE, and Medicare tax cut. Those are kind of part of the big picture because, as we all know, we are losing people to the tune of about 4,000 people a year are leaving the state, and it's because of high cost of living. We're losing doctors, nurses, professionals, and in general, even government is struggling. Right? We have a 30% vacancy in all our departments, and we just have a smaller workforce to deal with, and everybody's dealing with that, including the private sector. So these two measures is just one piece in trying to address that going forward. So thank you.
Mahalo, Representative Yamashita. Now please welcome Senator Lorraine Inouye, Majority Whip, Chair of the Senate Water and Land Committee and Vice Chair of the Transportation and Culture and the Arts Committee.
Aloha and good morning, and aloha, Governor. This is a great day. I introduce Senate Bill 1035 on behalf of our local doctors, dentists, and the healthcare workers who desperately needed relief from the general excise tax. I'd like to thank again Governor for the support of this measure, this bill, Senate President Kochi, the Senate Health Committee Chair, Senator San Buenaventura, both Money Committee Chairs, Senator Dela Cruz, more importantly, Representative Kal Yamashita, for bringing out my year-old SB 1035 into the hold of 2024, and the rest of my colleagues in both the Senate and the House for getting this bill to the finish line. And Dr. Jack Lewin, mahalo. I've known Jack, and that's why I can call him Jack, because he's a John. But Jack and I go over, we're like 30 years I've known Jack. We had very, very troubling times when I was mayor and he was the health chair under Governor Waihe, and we were in a battle trying to resolve our geothermal issues. And we're here today, both he and I guess we're kapunas, but we're here to address the people's work. Prompted by the dedicated medical practitioners of Hilo, and I'm so happy to see some of them here as well, and who worked hard on this. And I felt compelled to take action. Most healthcare providers on the Big Island practice in Hilo, serving patients from rural communities. SB 1035 seeks to provide essential relief to our healthcare providers and ultimately to the patients they serve and the patients who are at risk of or who have already lost their primary care, such as the elderly, who many doctors would not accept their insurance because of the unaffordable GET. And let me share with you, if you're an elected official and you're walking at the markets and you hear from the kupuna who is saying, Senator, I need help. I lost my primary care. It's hurting when I hear the doctors. I'm there at my own physical appointment to do my mammogram, and I'm hearing from the doctors there, can we speak to you as well? By exempting health care and dental services from the general excise tax for Medicare, Medicaid, and TRICARE patients, as Governor alluded to, SB 1035 alleviates financial burdens on the families, the elderly, and the disabled adults. This bill incentivizes the recruitment and retention of healthcare practitioners, fostering economic growth and job creation. And most importantly, SB 1035 is about equity and access to healthcare. Thank you, Governor. By eliminating the GET on healthcare services, we commit to ensuring equitable and universal access to care for all Hawaii's residents. I am proud to have the support of over 155 healthcare professionals from across the state. And let me share with you those that lobbied all of us, meeting them in the hallways. And I specifically told them, thank you for being here, because you're not here at the Capitol oftentimes. You're out there taking care of our people, taking care of your patients. Having them support this important bill was so important to us who do the people's work and who serve in this building. Their endorsement of SB 1035 highlights the urgent need for action and the positive impact this bill will have on our healthcare system and our communities. Let us seize this opportunity to enact meaningful change and ensure every individual in our state has access to the care they need and deserve. Mahalo. It's good to see all of you. It's a happy day.
Mahalo, Senator Inoue. Next, please welcome Representative Mark Nakashima, member of the member of the Consumer Protection and Commerce Committee.
Jasmine. Thank you, Governor. Good job, Governor. You're in charge now. Thank you very much, Governor, for your assistance. Mahalo to the Senate and especially my senator, Senator Lorraine Inoue, for moving this important bill today. SB 1035. The elimination of the general excise tax from Medicare, TRICARE, and Medicaid medical and dental services will have accomplished a number of different goals. One, it will reduce the financial burden on doctors and dentists while providing healthcare access to the lowest income families and kapuna in Hawaii. Secondly, it will enable our residents to access local providers for the health care and diagnosis that they need and treatment that they urgently need in a timely fashion. More importantly, especially with our state's aging population, this becomes even more critical. Finally, it is my hope that our communities will be able to provide quality care and access throughout the state with the relief that this bill provides. Mahalo.
Thank you, Gov. And next, we will begin to take facilitated questions from the media. So I'll go now to KITV. Kristen Concilio, have you a question? Let me bring the microphone to you.
I got this, man. There we go.
So I just wanted you to kind of explain, when we do tax cuts, what gets cut? Does social services have to be cut? Like, where does it come from?
Sure. So it's a great question. So if people couldn't hear, when we make tax cuts, does anything else suffer is the question. And the answer is no. So we won't be cutting services. We are doing several things already in advance. We're doing a deep dive right now as we see this historic tax break go into place. We're doing a deep dive into the costs that we have on the books that maybe shouldn't be on the books. It was alluded to earlier. We have about a 30% vacancy rate in our positions, yet those costs are carried year over year, and that's why often you see year-end surpluses of several $100 million, which help when there's a crisis, admittedly. But what we'll be doing in this interim right now, between now and the beginning of the next session, when I get to put in my first full 2-year budget, is we'll be looking at all of the vacancies essentially that have been there for 4 years or more. We'll even consider 3 years or more. These are positions that haven't been filled for several years. And look, we would love to have additional support, but we have been getting by in many cases with less. So we'll be doing 2 things. For the positions that we must have, we'll check on the ability to reprice those positions and slightly increase the salaries for people that we need to have in certain positions. But we will also make sure that we cut out some of the excess costs. And so we expect to present a budget to the legislature next year with fewer positions overall, so that we get rid of some of what has been perceived as waste. So there is that. Also, when people have enough resource to live and to actually cover their health care needs and to grow, you will not see as great a need in some of the other budgets like Medicaid. Our Medicaid budget is, I believe, in excess of $4 billion now. And by having people empowered, hopefully some of those costs will come down. By the same token, you've seen us work a lot on homelessness, for example. If individuals are homeless and on the street, the average expense is about $80,000 per person per year, because they go to the emergency department, they get very sick, they have traumas. The moment we put people into a kauhale, this is just one example, their costs are dropping over 70%. So better policy means we save resources for the taxpayers, and that's what we'll be focused on. There also does need to be an acknowledgement that we have had so many tourists in our state, and a lot of people were concerned about that before the pandemic even. And so we have been emphasizing, as we've gradually increased things like the TAT, we've been emphasizing that we get more resources in many cases from travelers. And they have been okay with it. As you can see, there's still a heck of a lot of people coming to the state of Hawaii, and our growth rate has been fine. So what I'm doing is I'm right-fitting government, and because of the legislature's generosity, being able to help local people.
Thank you, Governor. Our next question is from Ashley Mazzuol, Hawaii Public Radio.
Some of the progressive groups have been concerned about the kind of broad nature of these cuts. Can you guys talk about, what went into making that decision about why we went for a broad cut versus something that might be more targeted? I think one of their concerns being that big tax cuts are going to people who make over $147,000 a year.
Sure. I'm going to bring up a tax genius named Seth here in a moment. But first, I do want to describe kind of where this tax goes, and he'll have a chance. So if you look at the actual brackets, and we can give this to people, everyone will see actually that the sweet spot for this, the decrease, the percent change in the tax burden, goes like this. For individuals who are making $22,000 to $32,000, they will see a 64.1% decrease in their tax burden. For people in the income tax bracket of $32,000 to $42,000, they will see a 72% decrease in their tax burden. For people making $42,000 to $52,000, they will see a 71.43% decrease in their tax burden. I know this is exciting, these numbers. So just for people making $52,000 to $62,000, they will see a 63.3% decrease in their tax burden. And for people making much more, they're in the 10 to 15% decrease in their tax burden rate. And the point here is that we have actually made sure that the part of the curve is focused on people that are really paycheck to paycheck. And for a family of 4 or 5 making $100,000 in the state of Hawaii, they might very well be spending $50,000 or more on their housing alone in after-tax dollars. So there's not a lot for some people, and of course, those who are much lower are suffering more. Bring it up. Tax director, who's making this happen.
Aloha, everybody. So I think there's there's two issues that have been confused in the media. One is the progressivity of this tax cut. So in economics, the definition of progressivity is higher income people pay a larger portion of their income tax relative to low income people. By that metric, this tax proposal makes our tax income more progressive, meaning lower income people are going to be contributing a larger share or a smaller share of our income tax compared to higher income tax people. So right now, and I'm ballparking here, about high income people pay about 60 to 70% or 60% of our income tax. It'll increase to something in the range of 75, 80%, right? Now, what is confused here is since high income people already pay the lion's share of our taxes, they do get a benefit from this, right? So anytime the way our tax system is structured, that $30,000 of income is taxed all the way through. It doesn't matter if you earn $30,000, $35,000, or $1 million. That is taxed all the way through. If you don't have that, you have lots of problems with the distortions and things like that. So yes, higher income people will get a benefit. Since they're already contributing a large share of this, the dollar amounts can seem quite large, but that is inevitable for every single type of tax reduction possible. What was unique about this tax reduction is it's so focused on, it's not broad-based, it's not everything, it's really focused on the lower income. And so what you'll see is according to our analysis, from over the next 8 years, working class families are going to see their incomes increase by on the magnitude of between 4 and almost to 9-10%. That is, I evaluate social policies for a living, and I can tell you if any social group could effectively raise the income of working class families by 5 to 10% across the whole entire state, that would be an enormous win. And that is what this is accomplishing.
Do you have concerns?
No.
Okay, sir.
What we'll be doing is, with the adjustment of the tax brackets, we will be adjusting the withholding tables so that people will start seeing, I guess, they should be seeing larger paychecks come January 2025. And so we'll be getting that out as soon as possible.
That was Gary Yamashiroya, Director of the Department of Taxation. Suga Numa, sorry, the other Gary from DOTAX. Our next question from Honolulu Star Advertiser is from Andrew Gomes.
Thanks. Can I ask my question and then a quick kind of follow-up to Ashley's question also? So my question would be, was there anything in the green affordability plan that you proposed that hasn't been achieved with part 1, part 2? So could there be a part 3 next year that you would like to see happen? And then for just a follow-up, I understood everything Seth said. Why not cap it for the high level, and then everything would just be much more, for the working class and lower income families?
Sure. So I guess the first question is there anything left to do? Well, there's always work left to do. This tax plan, this tax break, so far exceeded our expectations in a positive way. It would be ungentlemanly to ask for anything more today. The other discussion we've had has been about, I believe, the child independent tax credit, which always has room to move. But what the legislature did is they actually simplified matters by dealing directly with the tax credit, the earned income tax credits that have been out there, and actually increasing the standard deduction over the last several cycles. And I really want to credit, in addition to Chair Yamashita, Chair Dela Cruz, and the team, also the Speaker. The Speaker, right off the bat after the elections occurred, got in my ear and said, we need something that's pragmatic, that will actually work. And that's what this is. It's just an exceptional move to help people who are struggling. The other part of your question is why not cap it? Well, we're trying to stimulate the economy at all levels, honestly, and we felt that it could be afforded. Again, a much larger percentage of the tax burden overall is going to be borne by people who have very significant means, and that's appropriate. That's appropriate when people can contribute to their society and help. And we heard that overwhelmingly across the board, but they are still getting a tax benefit. I believe in creating larger coalitions, and that's why you see a lot of very conservative thought leaders here in the audience today. We went out of our way to bring people together, because when we're not together, what happens? We spend 20 years trying to pass a bill like we did. I put in that bill on general excise tax for healthcare many, many times. And so it's frankly a miracle that Lorraine was able to get Jack and team to all come together. But bringing people together of different ideologies is something that we've been doing. You saw on housing, we brought together the housing advocates and people who felt strongly about deregulating the housing market so that we could build more housing. I'm trying to create that coalition on homelessness, and we seem to have created it on tax policy.
Daryl Huff from Hawaii News Now.
Thank you. Governor, how large a proportion of the medical community is going to be benefiting from the excise tax? And why not, if it's so urgent with doctors leaving all the time, can we not move up the effective date of that tax break? Because right now it's not until January 2026, I believe. And you've got an urgency here.
Yes, so I appreciate that. So a couple things. We've taken some pretty large measures in the past, say, 18 months on this matter. One of the things was to get parity, moving the Medicaid payments up, especially for primary care, up to the table for Medicare. That was like a 30% increase, and very necessary because Medicaid rates are extremely low. There are extremely few physicians, nurse practitioners, or PAs that don't take a significant number of patients in the Medicaid and Medicare class. Very few. So it probably is going to help everyone. There was a time when 51% of the Big Island relied on Medicaid. 51%, which means that essentially every provider on the Big Island, myself included, cared for individuals on Medicaid. So this crosses all groups. As to the shortage, we're going to see a really rapid decrease in the shortage for healthcare providers in the state, because we're also, forgive any of the more mature and senior doctors here, okay? Jack, you're the oldest, okay? Those guys paid their loans back, all right? So they didn't benefit from the loan forgiveness program, of which we're giving to hundreds and hundreds of doctors, nurses, and mid-level providers. So it helps us to recruit. Dr. Withy's work, which we used to just have a trickle of these scholarships. Now we did 475 or so in the first batch. We're doing another 500 this August, and we will be knocking down the barriers to come and practice in Hawaii. Now we begin, as that program begins to mature in 2026, with the benefit on the tax break. And if I'm being just very blunt, I try to control for variables so we can see what is actually working. And make no mistake, the tax breaks that are being enacted today with my signature and the legislature's hard work across the board are going to help healthcare providers. They will also be paying significantly less tax, so they'll be able to work here. So it does help essentially small businesses too.
We have what promises to be a small follow-up.
Oh,
Yeah, but the distinction I was trying to make is between the for-profit and non-profit, because this is really for the ones that can't pass the tax back to their they're paying the tax in the first place, because the nonprofits aren't paying. That's what I was trying to get a sense of, what proportion of the healthcare system is going to benefit directly from this tax.
Sure. Yeah. The so most of the hospital systems, as you know, are not for profit, and most providers are just regular businesses. They're LLCs. That's what a practice usually is. It's a small business, although there are, of course, individuals that are also salaried. So that is a reality of our healthcare system. There's just so many people on Medicare and Medicaid. So it's not just that we have 465,000 individuals on Medicaid. We also have well over 100,000 individuals in our state that are Medicare eligible. So I believe it's more than half of our population. 300,000, there you go. So you're now talking about over 700,000 of our 1.4 million individuals are either on Medicare or Medicaid. So you will see this this change in our reimbursement system essentially penetrate all parts of our state's healthcare system.
Final follow-up question from Ashley Mizuo at HPR.
I just wanted to have it clarified. When you're talking about fewer positions next year going into the budget, are these positions filled? So are people like
Yes,
job
thank you for that
security-wise?
clarification. No,
Yeah.
these and so no one should worry. We do not intend to cut anybody's working position. We will be looking at vacancies that have been at first vacant for 4 years or more. So if they've been vacant for 4 years or more, you know, when asked by my own team whether or not we should take that move, I said, look, give me a break. If we can't fill it after 4 years, let's right-fit our government. Let's begin to invest in technologies where they can help, and let's pay people better so that they stay in these important jobs, whether they are HGA, UPW, any of our public workforce. I'd rather see people paid a little bit better, and we get rid of some of the excess that's been in the budget. Interestingly, my own cabinet has shared with me that this makes it a little tougher on the executive branch. This is usually the work of the legislature, knocking out vacant positions that haven't been used for a long time. I was a part of that process for 14 years with my dear friends. I just figured, let's just be honest about our budget. Let's cut positions that have not been filled for a very long time. And if people make a compelling case to me to increase the salaries for certain positions that we need desperately, we'll do it. So honesty in our budgetary process is important to me. And I think we will have a pretty dynamic proposal for people. I will tell you in advance right now what we hope to do. We hope to continue to work on affordability, thus the tax break. We're going to need to continue to build housing, so those revolving housing funds are going to be very important. And then finally, scholarship programs, increased reimbursements for healthcare and dealing with homelessness, central to a healthy society. That's a preliminary glance at what our budget will be, but to afford those things, we're going to be more prudent. And I'm very excited to see more health care for people, lower taxes for people. I think that is the fundamentals on progressive government.
Mahalo, Governor. Closing remarks, or are you good?
Well, look, we've been on a journey. In the last, say, 2 or 3 weeks, you've seen several things. You saw us take on short-term rentals, which are preventing a lot of our people from having a place to live. And that's costing us dearly because with too little housing, because we have far too many short-term rentals, costs are astronomical. Not just here, also on Maui. So you saw us take action on that. Step 2, actually changing our housing policy. You saw the legislature take major steps in order to provide more housing, period. And we all have to agree to work together. That's why I was grateful to see people accept some modest changes where we'll build Ohana units, we'll build ADUs. More housing inventory, prices should come down, it should be very healthy. Condominiums are struggling a little bit. Speaker's been a star on this, helping to make sure that those who live in condos can still do it, bringing down their costs, pass significant legislation. And then finally, this most fundamental piece, actually getting tax dollars back to people who are ALICE families, asset limited, unable to make enough money to survive in Hawaii. These are foundational changes. We're supporting the healthcare system. We're dealing with homelessness, as you saw. But that is our purpose. Our purpose is to actually transform Hawaii to the benefit of all. And when viewed through that lens, those multiple initiatives, I hope you can see that is our approach to help our Ohana. One taken apart from the others may seem to not, I guess, pencil out or make enough sense, but when viewed as a whole, it should make Hawaii a more extraordinary place for our families now and for the next generation. So thank you, everyone, for understanding. Aloha.
Mahalo, Governor. At this time, I would like to invite Governor Green, our state legislators, and any key stakeholders to come up to the podium for the formal bill signing and subsequent picture taking.
So the first bill is I'll do the tax rate bill.
Okay. So we're doing 2404.
2404 is being signed first.
Okay. So his signature, family should find it more affordable to live in the state of Hawaii. Speaker, come. This is for you, brother. Thank you.
All right, everybody looking here, please. 1, 2, 3.
Mahalo.
Here.
Oh, can I get over here? 1, 2, 3. 1, 2, 3.
Right here. 1, 2, 3. Got it.
And Star Advertiser, one more time.
Just one last. Just one. Thank you, Governor.
You want to talk on the stage?
Yeah. I'll be right over here.
I first proposed some version of this bill in 2006. So I'm grateful. I was 7 years old. This relates to each other. And I just really, this pen could easily go to Lorraine, but now give it to Shima.
Sure, please.
And have everybody squeeze in as much as possible as well as we can.
Do what you gotta do, Noel. Part the Red Sea.
I'd be remiss if I didn't also say the Hawaii Medical Association really was very supportive throughout this whole process, as Lorraine shared. It was amazing. So thank you for that long follow. Thank you, Governor.
Mark, you gotta come up.
1, 2, 3.
We're tired.
Okay, over here. Okay, 1, 2. Okay, 1, 2, 3. 1, 2, 3.
And right here. Ready, 1, 2, 3. Got it.
Get one right over here. Nobody move around, okay? Here we go.
Taking the panel.
Thank you. Got everybody.
Wait for you first.